your body doesn't just age, it changes the rules completely, and most people never see it coming. And here is the thing that makes it so difficult. It does not matter how strong you were in your 60s. It does not matter how active you were in your 70s. It does not matter how many miles you walked, how well you ate, or how carefully you took care of yourself all those years. Because when you cross that threshold into your 80s, your body starts operating by a completely different set of rules. Rules that most people have never been told about. And if you are not aware of what those rules are, they will catch you off guard in ways that can genuinely change the course of your remaining years. Now, here is what frustrates me the most as a doctor. Most people do not learn about these changes until they are already living with the consequences. They come into my office confused, worried, sometimes scared, and they say, "Dr. Ellison, I was perfectly fine just a year ago. What is happening to me?" And I have to sit down, look them in the eye, and explain that their body did exactly what it was always going to do. They simply were not prepared for it. So today, I am going to make sure that does not happen to you. Whether you are already in your 80s, approaching your 80s, or you have a parent or grandparent at that stage of life, what I am about to share with you could be some of the most important health information you will ever hear. I'm Dr. Sarah Ellison, and I've spent over a decade as a practicing cardiologist working closely with senior patients, helping them understand what is happening inside their bodies and how to protect their health, their independence, and their quality of life during the years that matter most. Today, I am going to walk you through 5 specific things that begin to happen once you turn 80. Not to frighten you, but to prepare you. Because when you understand what is coming, you can face it with strength, knowledge, and control. Okay, now, let us get into this, because what I am about to tell you, most doctors will not say this directly. The first thing that happens once you turn 80, and this one catches almost everybody off guard, is that your body begins losing muscle at an accelerated rate that is unlike anything you have experienced before. Now, I know what some of you might be thinking. Dr. Ellison, I have been hearing about muscle loss since I was in my 50s. This is not new information. And you are right. Muscle loss does begin gradually in your 30s and continues throughout life. But here is the part that most people simply do not understand. The rate of muscle loss between the ages of 30 and 70 is relatively slow and manageable. We are talking about losing roughly 3 to 5% of your muscle mass per decade during those years. But once you hit 80, that number jumps dramatically. We are now looking at losing up to 15% of your remaining muscle mass within a single decade, and in some cases, even faster than that. This condition has a medical name. It is called sarcopenia. And after 80, it becomes one of the most dangerous threats to your independence, your mobility, and honestly, your life. But here is what makes it even more complicated. It is not just about your muscles shrinking. Your nervous system slows down too. The signals traveling between your brain and your muscles become less efficient, less sharp. So even when you want to move quickly, even when your mind says go, your body simply does not respond the same way it once did. And that is exactly why balance problems begin to surface. That is exactly why falls become more common. And let me be very direct with you about falls, because this is the part that genuinely concerns me as a physician. A fall at 80 is not the same as a fall at 50. At 80, a fall can mean a broken hip. And a broken hip at this age carries a mortality rate that shocks most people when they hear it. Studies show that roughly 20 to 30% of elderly adults who suffer a hip fracture pass away within 1 year. Not from the fracture itself, but from everything that follows. The immobility, the infections, the blood clots, and the rapid overall decline that comes from being bedridden. So what can you actually do about this? Because I am not here to simply frighten you. I am here to give you real, practical answers. Resistance training does not stop working just because you are 80 years old. Research has consistently shown that even people in their 80s and 90s can build muscle and improve their strength through appropriate exercise. I am not talking about heavy lifting or intense gym workouts. I am talking about simple, safe, manageable movements. Chair squats, resistance band exercises, light dumbbell work, even body weight movements done consistently can make a tremendous difference. Aim for at least 2 to 3 sessions per week. And alongside movement, please pay attention to your protein intake. Most seniors in their 80s are simply not eating enough protein, and that nutritional gap is quietly fueling muscle loss. Aim for at least 1 gram of protein per kilogram of your body weight every single day, and spread it across your meals rather than trying to consume it all at once. Your muscles need that steady supply to maintain themselves and recover after exercise. Now, as serious as muscle loss is, the second change that begins after 80 is one that I find even more personal for a lot of people, and it is one that causes a great deal of unnecessary fear. So I want to address it very carefully. The second thing that happens after 80 is that your brain begins to process information differently. And I want to be very clear from the start, because there is a distinction here that is critically important. There is a significant difference between normal age-related cognitive changes and dementia, and too many people confuse the two, which leads to panic that is often completely unnecessary. Here is what is actually happening inside your brain. By the time you reach 80, you have lost a portion of what scientists call white matter. These are the neural highways that connect your thoughts, your memories, and your movements. And to compensate, your brain does something remarkable. It begins rewiring itself. It starts building new detours around the pathways that are fading. It reroutes signals through alternative routes to keep you thinking, remembering, and functioning. It is your brain's way of adapting, of surviving. But this rewiring comes with noticeable effects. It might take you a little longer to recall a name. You might find yourself searching for the right word in conversation. You might walk into a room and briefly forget why you went there. And for many people, this is where the fear sets in. They start worrying about serious conditions. They begin pulling back from conversations, from social situations, because they do not want to feel embarrassed or exposed. But here is what I want you to hold on to. A slower brain is not a broken brain. In fact, something fascinating happens during this rewiring. Your brain begins to prioritize emotional memory over technical detail. That is why at 82, you might forget what you had for lunch yesterday, but you can vividly recall the smell of your mother's kitchen from 60 years ago. Your emotional core remains remarkably strong, even as processing speed naturally decreases. However, I do want to be honest with you about the risk, because you deserve the full picture. After 80, the likelihood of developing actual dementia does increase significantly. By the age of 85, roughly 1 in 3 people will have some form of dementia. That is a number we cannot afford to ignore. But what the research also tells us, and this is the encouraging part, is that people who remain mentally active, socially engaged, and physically moving have significantly lower rates of cognitive decline compared to those who become sedentary and isolated. One of the most damaging things I see in patients over 80 is social withdrawal. They stop meeting friends, they stop attending community events, they spend more and more time alone. And social isolation is one of the most powerful accelerators of cognitive decline that we know of. Your brain needs stimulation. It needs conversation, challenge, and novelty. So whether it is a book club, a card game, a community class, or simply a daily phone call with someone you love, keep your brain engaged and keep yourself connected. And one more thing about brain health after 80 that I cannot leave out. Sleep becomes absolutely critical. Your brain uses sleep to clear out toxic proteins, including beta amyloid, which is directly linked to Alzheimer's disease. When your sleep is poor or fragmented, those proteins accumulate faster. So please do not accept poor sleep as simply a normal part of getting older. Talk to your doctor. There are real strategies that can help, and they could make a meaningful difference in protecting your brain for years to come. Now, speaking of things people do not want to talk about, the third change that happens after 80 is one that quietly puts millions of seniors at serious risk, and most people do not realize how advanced the danger becomes at this stage. The third thing that happens after 80 is that your bones become significantly more fragile. And similar to muscle loss, bone density does begin declining earlier in life, particularly for women after menopause. But after 80, something shifts. We reach a point where the bones have lost so much density that even minor impacts can cause fractures. But here is what most people do not realize, and this is the part that truly concerns me. Your bones are not simply getting thinner on the outside. The internal architecture of your bones, a patellary cell cortex, spongy inner network called trabecular bone that gives your skeleton its structural strength, becomes increasingly porous and weak from the inside out. This means that a simple stumble, bumping into a piece of furniture, or in severe cases, even a forceful cough or sneeze, can cause a compression fracture in your spine or a fracture in your wrist or hip. And once you experience one fracture, your risk of suffering another doubles or even triples. It creates a dangerous cycle that becomes harder and harder to recover from with each passing year. So what do you do? First and most importantly, if you have not had a bone density scan recently, please get one. You need to know where you stand. Knowledge is your first line of defense. Second, make sure you are getting adequate calcium and vitamin D. Most adults over 80 need at least 1,200 milligrams of calcium per day and between 800 to 1,000 international units of vitamin D. Many seniors are significantly deficient in vitamin D without even knowing it, and your doctor can check this with a simple blood test. But beyond nutrition, the single most powerful thing you can do for your bones after 80 is keep moving. Walking, standing exercises, gentle dancing, even simply standing up and sitting down repeatedly. These activities place healthy stress on your bones, and your bones respond by reinforcing themselves, by building new tissue. Every step you take is literally sending your bones a message to stay strong. And the moment you stop moving, your bones receive the opposite signal. So please, keep moving every single day. And while we are on the subject of movement and falls, the fourth change that happens after 80 takes that danger to an entirely new level. And this is the one I see affecting my patients in ways that are truly heartbreaking. The fourth thing that happens after 80 is a significant decline in balance and coordination. And while this is connected to muscle loss and bone fragility, it is also very much its own separate and serious issue. After 80, multiple systems in your body that work together to keep you upright begin deteriorating at the same time. Your inner ear, which houses your vestibular system, the system responsible for your sense of spatial orientation and balance, becomes less sensitive and less accurate. Your proprioception, which is your body's ability to sense where it is positioned in space, also fades. And your vision, which plays a massive role in maintaining balance, often worsens further in your 80s due to cataracts, macular degeneration, or other age-related eye conditions. When you combine weakening muscles, more fragile bones, a declining vestibular system, reduced proprioception, and worsening vision, you create what I often describe to my patients as a perfect storm for falls, and the statistics are alarming. Roughly 1 in 3 adults over 65 experiences a fall each year. But after 80, that number climbs even higher, and the consequences become far more devastating. I want to share something with you that I think is one of the most overlooked pieces of this puzzle. Many seniors over 80 are taking multiple medications, and some of those medications, blood pressure drugs, sleep aids, certain antidepressants, antihistamines, and even some pain relievers can cause dizziness, lightheadedness, or drowsiness, all of which dramatically increase the risk of a fall. I had a patient, a sharp and active 81-year-old woman, who had been struggling with unsteadiness for months. After a thorough medication review, we discovered that a combination of 2 of her prescriptions was causing her blood pressure to dip when she stood up too quickly. A simple adjustment changed everything for her. So if you or someone you love is feeling unsteady, please ask your doctor to review every single medication being taken. It could make all the difference. Now for the solutions. Balance training should be a non-negotiable part of your daily routine after 80. Simple exercises like standing on one foot while holding a chair, heel-to-toe walking along a straight line, or gentle Tai Chi adapted for seniors can train your brain and body to maintain stability. And here is something truly encouraging. Balance can be improved at any age. Even if you feel unsteady right now, even if you have already experienced a fall, you can regain significant balance ability through consistent, dedicated practice. And please, do not let pride stand in the way of your safety. If you need a cane, use it. If you need a walker, use it. If you need grab bars installed in your bathroom, get them installed today, not next week, today. These are not signs of weakness. They are tools of independence. They are what keep you safe, keep you in your own home, and keep you living life on your own terms. Now, with everything we have covered so far, muscles, brain, bones, and balance, the 5th and final change might actually be the most important one of all, because it quietly affects every single system in your body at once. The 5th thing that happens after 80, and I truly believe this is the one most people underestimate, is that your immune system becomes significantly weaker. This process has a medical name. It is called immunosenescence, and it is one of the primary reasons why adults over 80 are so much more vulnerable to infections, illnesses, and even certain cancers. Think about what your immune system has been doing for you your entire life. For 8 decades, it has been fighting bacteria, viruses, and abnormal cells every single day without rest. But after 80, it begins to wear down in ways that have real and serious consequences. Your body produces fewer new immune cells. The ones you still have become less effective. And your inflammatory responses become dysregulated, meaning your body can overreact to some threats while dangerously underreacting to others. This is why a simple cold or flu that a younger person might shake off in a few days can send an 80-year-old to the hospital. This is why pneumonia is one of the leading causes of death in adults over 80. And this is why something as seemingly minor as a urinary tract infection, which causes relatively mild symptoms in younger adults, can trigger confusion, delirium, and serious complications in elderly patients. Your immune system simply does not have the same firepower it once did. So what can you do to support it? Several things, and all of them are within your reach. First, nutrition becomes even more critical at this stage. Your immune system depends on specific vitamins and minerals to function. Vitamin C, vitamin D, zinc, and selenium are all essential for immune health. Eating a varied diet rich in fruits, vegetables, lean proteins, and whole grains gives your immune system the raw materials it needs. Unfortunately, many seniors over 80 struggle with appetite or with preparing meals, which leads to nutritional deficiencies that silently weaken immunity further. If this is something you are dealing with, please talk to your doctor about it. Second, stay current on your vaccinations. The annual flu shot, the pneumonia vaccine, and the shingles vaccine can be genuinely life-saving for adults over 80. Your immune response to vaccines may not be as strong as it once was, but even a partial immune response offers far greater protection than none at all. Third, keep moving. Exercise has been shown to boost immune function even in elderly adults. Moderate physical activity increases the circulation of immune cells throughout your body, reduces chronic inflammation, and improves your overall resilience against infection. You do not need to do anything extreme. A daily walk, some light stretching, gentle resistance exercises. These are enough to give your immune system meaningful, measurable support. And finally, there is one more connection I want you to understand, because the research on this is both powerful and deeply important. Chronic loneliness and social isolation directly suppress immune function. This is not just an emotional observation, it is a biological fact. Loneliness raises cortisol levels, increases inflammation throughout the body, and suppresses the activity of your natural killer cells. These are the immune cells responsible for detecting and destroying cancerous cells and virus-infected cells. Loneliness is not just an emotional burden, it is a physical one. It weakens your body's defenses at the cellular level. So once again, staying connected, staying engaged, staying part of a community is not simply good for your emotional well-being, it is essential for your physical survival. Now, before I let you go, I want to say something that I believe needs to be said much more often. Every single day, you have a choice. You can allow these changes to define you and limit you, or you can meet them with movement, with nourishment, with connection, with rest, and with a quiet but stubborn refusal to stop showing up for yourself. I have seen 80-year-olds who move better than people 20 years younger. I have seen 85-year-olds with sharper minds than patients half their age. Age is a number. How you age is a decision. And it is never too late to make a better one. If this video was helpful to you, please do me a favor and share it with someone who needs to hear this today. A parent, a grandparent, a neighbor, a friend. This information can genuinely change someone's life. Subscribe to the channel if you have not already, and leave me a comment below telling me which of these 5 changes surprised you the most. I read every single comment. This is Dr. Sarah Ellison, and I will see you in the next video.